Hi everyone, welcome back to another episode of Beyond the Script. I'm Ivy Catherine, and today we are joined by the Brahmbhatt sisters. We have Rutvi, who is a first-year family medicine resident, and Suhangi, who is a second-year med student, and they very kindly agreed to come and chat about their journey in medicine. Thank you guys so much for being here today.
Thanks for having us.
So I want to know first, be honest, who decided to go into medicine first, and did the other copy?
Ooh, that's a really interesting question. Okay, I'm going to be honest. I think uninformed, I probably wanted to, I said at a younger age, I'm like, oh, I'm going to be a doctor.
Okay.
We used to have, a cute stethoscope kit, so I'm like, it's going to be me.
Yeah.
I think informed decision was probably her.
Yeah.
Though.
I think, for a really long time, medicine was probably at the, it was in my consciousness because, where did that stethoscope kit come from? Basically, context was we were learning about the human body, and I was so extra at, a 9-year-old age.
Yeah.
I was like, well, this is really cool. So I literally went and borrowed my friend's mom's lab coat. She just worked as, a lab tech. And I was like, it's a white coat. She's got to be a doctor.
Yeah.
So I took her white coat. I went to Dollarama and bought one of those, fake stethoscope kits.
Oh, my God.
And I presented on the cardiovascular system. So I agree. I think
At 9?
Well, she was a try-hard.
I'm telling you,
try
I was
hard.
actually
She was one of those
literally.
ones.
Oh, okay.
Anyway, I take deep pride in that. Anyways,
Well, I got you where you are, so it's fine.
Sure.
but
Yeah.
all that to say, but I think I definitely toyed with the idea of other careers a little more than she did probably because at one point I considered biomedical engineering,
Yes, okay.
and I was really interested in that. But I think by the time I reached high school / end of high school, I was pretty dead set on knowing I wanted to pursue medicine because I had kind of worked through the other options and realized what I was missing from that other options was in medicine.
Okay.
Yeah. I don't think I would say necessarily though that either of us influenced each other. I think we came to the decision on our own.
Yeah.
But obviously seeing her go through the journey, I'm
Yes.
okay, you know, I know what I need to do and I understand the pathway and
Yeah.
I think
But
that
also
influenced us.
and having because she was interested in medicine, it was just something that we
We
did,
talked about it.
we
of
did
course.
together.
Yeah,
We
that
would
makes
volunteer together
Yeah.
or do we always loved the human body, and I knew that was a shared interest.
Okay.
So
We
in
would
that
just
way
talk
we
about,
did
bio.
yeah.
We were kind of nerdy.
We are nerds.
I did not talk about that stuff with you. But cool that you guys did. That's so cool. Okay, so growing up, did you guys compete with each other? Does that competition still exist? Or was
Good
it
question.
a lot more chill than that?
I think we're both very
We are competitive
Have to be.
people.
Yeah, you
Yeah.
definitely have to
Medicine,
be.
right?
Yeah.
Yeah.
And we did a lot of competitive things as kids. So we
Yeah.
participated in a lot of national mental math competitions. We both have black.
Mental math competitions?
Yeah.
Yes.
Yeah.
Plug for UC Mass. I don't know if you've
Yeah,
ever
I don't know
heard
if
of
anyone's
it.
ever heard of it, but it's
have you heard of an abacus? The Greek. I
No.
think it's Greek, Roman. Yeah, it's
Oh.
the bead-based math system.
Oh, okay.
People
might have seen
kids
it.
play with it, and they have different colored beads, but the one we used was
A smaller version,
Yeah.
kind of. So they teach you how to do quick maths, basically.
and how to integrate that system into your head. So growing up, at least for most basic being a very loose term, we didn't really need a calculator, which actually worked out in our favor because when you write the MCAT, you're not allowed a calculator.
Yeah, it wasn't even basic. It was
We're talking about 5 to 6 digit mental math equations,
superscript, multiply,
divide,
yeah. Don't test our math skills
I was
right
about to say, I
now.
was okay.
No, for context,
long
you're given
gone.
8 minutes to do 150 to 200 questions.
Yeah.
Oh my gosh.
And
We'd
you-
compete nationally
yeah.
and it was cool.
Yeah.
So we were very competitive when it came to that. We both have black belts in Taekwondo.
Yeah.
So we were very competitive.
Yeah.
Oh,
You didn't know this about. Oh yeah, we have black belts in Taekwondo.
We do.
Yeah, it's just a fun fact.
you guys are so rounded. How do you have
Thank
time
you.
to do how did you have time to do that?
My mom.
Honestly,
was a
credit
very,
to our
yeah.
parents. They
gosh.
really made it a point to be you're not just gonna go to
Just-
school.
okay, that's good.
You're
And
gonna
she's
go
like,
do a bunch
yeah,
of things.
yeah. She's
Black
like, oh, you
belt?
don't like it? Oh, okay, you're gonna
You're
do
gonna
it.
do it.
You don't want to try this? Now you're
now
gonna
you're
try
definitely
it.
going every week.
Yeah.
But yeah, we did a lot of competitive activities, so we're competitive in that sense.
Yeah.
But I don't think we ever competed with each other.
Okay.
We were more keeping each other in check.
Yeah.
You're kind of slacking.
You
wanna
need to
win,
pick
so
up
lock
the
in.
pace.
Okay.
Yeah. Or if we were ever sparring or anything, for example,
Yeah.
and it's I see you getting tired, there's someone ahead of you. You need to work a little
Okay.
bit harder. So
Wow.
we were constantly pushing each
Competitive
other
for
to
each other.
Yeah,
That
exactly.
makes sense.
Yeah.
Yeah.
Okay.
Yeah.
That makes sense.
Yeah.
That is black belt. I'm still stuck. Okay, so you guys are talking about you're kind of competitive. What is something that you guys both think that makes the other well suited for being in medicine?
Oh, I think I can go first on this one.
Okay.
I feel like I know, and I've known this about her since, like, she was literally in the womb.
Okay.
She is, like, she has such amazing foresight. Like, she is always 10 steps ahead of the game. Like, she knows what's happening right now, and it's almost like she's, like, dealing with what's happening right now subconsciously, and then she's, like, 10 steps ahead of the game. She knows what's going to happen. She knows how to plan for it, and I think when you're a physician, and as someone who is a physician now, I can confidently say that is the type of person you want taking care of you. You want someone who can deal with what's happening right now, but can anticipate what's going to happen and be well prepared for it, because I think that's the best way to manage health and provide health care. And I think she, like, it is literally like she thinks like a doctor. Like, if there was any way to describe how a physician should think, like, she just has like really, really good foresight.
Oh, I believe it.
Bro,
yeah,
that's so cute.
Yeah, no, but like, I don't say this to her often, but I think
like,
she
does.
I didn't know. Well, someone's got to keep her in check, like.
Okay.
But she actually, like, and it's something that I'm really proud of for her. Like, she just has very, very, very amazing insight.
That's
Guys, as a younger sister, to hear my sister say she's
You're not
proud of
gonna.
me,
You're not gonna.
like
That's the
validation
1
that
year,
I
like.
work for.
That's the 1 year quota. Yeah.
once a year you get a compliment.
Yeah. Exactly.
Wow.
No, this is so unrelated to the question, but we did like this trivia thing on our Instagram where she'd ask me questions, and it was like she didn't let me look at the questions beforehand, so she was like, no, we're gonna do it on spot, like test her medical knowledge. And afterwards I guess I did like decently well on it.
She did pretty well. I'll give it to her.
So she was like verbally telling me I did so well. I was like, can you text me
She
that
made
I did
me-
well? So I have written proof, and then I screenshotted
get
it.
that.
She's like, I need to remember this moment.
Oh
I was
my
like,
gosh.
she's like, why do you want me to text you? I'm like, just do it.
Dude,
I'm so confused.
If I get a nice text, I screenshot it because
Yeah.
She literally-
words are a
she was
big
like,
deal to me.
Can
Literally.
you just send that to
Go
me?
back
And I
read
needed
it
in written proof
So you
that you
keep it,
actually,
you have it.
So you
I
can't
get
go
that.
back on your word.
Yeah, fair enough.
But to circle back to the question, I think something about her that we've all always known is how much empathy she has. Like, anyone that knows her knows she has the biggest heart. And I think that's exactly what you want in a doctor that you have. Like, you know, someone that can think from the patient's perspective and like make decisions in the patient's best interest. And I think in medicine, like, you're inherently trained to think like a doctor. You're trained to be smart and like, you know everything essentially, or at least know where to look and how to come up with like a list of possible like a diagnosis. But I think you can't really be trained to be empathetic. You can learn how to like, you know, show empathy, but to like inherently be empathetic is not that easy. And the longer you progress in the career, I think it's really easy to get burnt out. And like, you know, if it's not who you are naturally, like you will have to like step back, train, or like, you know, take a break and then come back. And I think hers is the complete opposite. I think she grew up honestly thinking that being so like emotional and like empathetic might have been like a weakness of hers, but I totally disagree. And I think if I wanted a doctor, it would be her. Like truly, like she is so empathetic. Anyone that knows her knows she has the like most massive heart and will care for every single person there. She's so inclusive,
I can't
except
look at
me.
the
She
camera.
cares about everyone but, no, I'm kidding. Yeah, except me. But no, yeah, I think her empathy and her kindness like radiates. And even when like you read her reviews from preceptors that she's worked with, or like she'll come home and tell us stories about like, oh, like, you know, I had a really great patient encounter today, like they were really nice and they said XYZ, or my preceptor's review said XYZ, like they rank you later on, or they'll like write things about you. I can't remember a single review where they didn't say you are so kind, you are so empathetic, like, you know, you think for the patient and like you share everything with them and like think on behalf of them.
That's so
and it's
sweet.
like, wow, like I want a doctor like that, you know, like
absolutely.
I want someone to be so worried for me, or like so caring of me that they're like, you know, let me think for you, let me think for the best of you're the best outcome that you could possibly get, and care like that, even though I'm tired and I'm like burnt out. And I think she has it.
That's like the nicest thing she's ever said about
It's the one
me.
you brought this out in us. It's not coming.
I know. I can't believe you like brought this side of us.
You know, I like to do that, and also all this is on camera, so you can
So
go back and watch
the
it.
OMA brings families together.
Yeah. You can go back and hear all this when you need
That,
to.
I know. I need to. Maybe I'll like take a screen recording.
tease us that one
Literally.
clip. Okay, I love
Oh
that.
my gosh. Wow.
Okay.
Thanks.
Are you guys like? You're both obviously in medicine. Are you like at the point where you ever like ask each other for like medical advice, or is that like off limits? Is that like, not something you do or can do?
I don't think she has ever asked me because like obviously I'm like lower in training.
Okay.
I will say I ask her a lot.
Okay.
I think she'll always say like she gives me a whether I need to go to the family doctor or not kind of vibes.
Okay.
You know, like she won't be like, oh, okay, like you need a prescription of XYZ, but it'll be like, okay, like this is not that serious, like relax, or like, you know, maybe you can go to the doctor, it'd be good.
Yeah.
Because like I invested in this girl years, emotional effort, mental effort, like financial, like, you know what I mean?
Yeah,
like, I was investing in you, so this is my payout of
Okay, fair enough.
like, does this look weird?
Yep.
Like, is it weird that I'm feeling this way?
Yeah.
So
I feel like, like, I agree. I think I asked less, but it'll be like, okay, if it's not prescription required, can you do something about it at home?
Yeah.
Like, do with it what you can.
Okay.
And then if you need a prescription or if you need testing, I'm like, you need to go see your doctor.
Right.
Yeah. Girl, this looks questionable. Go.
Okay.
Yeah.
Do your other family members do that with you too?
She's been the doctor of our extended family friend group. No, like before she became a doctor.
Yeah.
My parents like verbalized she's in health sci and like wants to become a doctor. And people are like, oh, like, you know, you can help me with this and like tell me this. And it's like obviously like she didn't. She's like, oh, I'm actually not a physician yet.
Yeah. I think it's like it's such a fine balance between saying like, yeah, like I actually want to become a doctor or I'm in medical school versus somebody being like, so like, can you look at this rash? And it's like, well, I think you should probably show that to like a qualified MD.
Yeah, okay.
But yeah, like I think for minor things, like if someone has a cold and I know what's gonna like help them feel better, if it's not a prescription, you know, I know like the general non-medicinal things that will help them. You know what I mean? But if it's anything that requires any form of like medical advice or like they need testing, they need a prescription, whatever, like that you need to go find your doctor and I will be the first to be like, you can't ask me this, like this has to go to your doctor.
Okay. Do you mind it? Like, do you mind?
I honestly don't mind. I think like I understand where it comes from. Especially within our family at least, like we've like in the history of like my ancestry, we've never had a doctor in the family, and so
That's a big deal.
So I think like it's a big deal for my family too. So when they ask me, it always comes from a place of love of like, oh, like we finally have an in, like we know somebody who knows something about health, you know. So I understand where it comes from, so I'm never mad about it. Honestly, if anything, I'm always like, this is their like form of like love and respect. You know what I mean?
They must respect you enough to
exactly. Like I'm always like they genuinely trust what I have to say. But I think like that having that comes with the responsibility of knowing like when to draw that line and say, okay, you know, I'm happy to like help you, but also like I know that this is something that you need to seek further help for.
Like it's like I said, telling them, you know, okay, this is something that you should see a doctor for versus like, okay, it's a cold, it's day 2, like you can maybe wait it out if you're feeling like relatively okay. I think a big one that she does in our like extended family group in particular is like explaining things that maybe haven't been explained in a lot of detail, maybe because of like a language barrier. So if like people are like, oh, you know, the doctor told me to exercise or lift weights, for example, because I'm pre-diabetic. And it's like, why do I have to do that? And maybe the doctor briefly counseled them on like, you know, building muscle and like, it's really good for like glucose, like, you know, to help you in that sense. But like, they maybe haven't had the conversation in detail or they didn't understand what to ask or what to say. So I think in those cases, like lifestyle modification things, she's really good at like, oh, like, you know, I can tell you why you need to exercise. I can tell you why you need to take a walk every day and stuff like that, which they really appreciate. And honestly, I feel like our family friend group has gotten like healthier because she's like, I think you should do this. I think you should eat that. Like,
there you go.
This is a good idea. This is maybe not so good.
I think it comes from like, and I think this is between the both of us. Like, we genuinely have a passion for like health education and health literacy, especially for like communities who don't speak English as their first language, because we come from that community. And I think like it's part of what drew me to family medicine to begin with anyways, was like the opportunity to like give patients the education they need, like to empower them with knowledge. Because you treat patients, that is my job, but also part of my job, the way I see it, is like giving patients the tools but also knowledge they need to like be more in control of their health and take ownership over their health. And I feel like we were able to do that at home just by pursuing a degree in medicine.
Wow, that's awesome. That's so cool. You guys are, that's crazy. What would you say, this is a question for you, what is something about medicine that feels like completely different between med school and residency?
A lot of things, but I think probably the biggest one that like comes to mind first is like the level of responsibility that you have.
I can't imagine that.
When you are a medical student, you're very well protected in the sense that you have a resident, sometimes multiple residents, and then there's an attending. Sometimes there's also a fellow with the attending. There are several people within that line of care who are there to double, triple, quadruple check your work, but also who act as kind of soundboards for you to ask questions to and learn from. As a resident, those layers still exist, but there is also an extremely heightened sense of responsibility, and I feel like I felt it on my first day as a resident almost, because suddenly when you're being asked questions by, you know, nursing staff or by people who are involved as a part of the care team, what you say really matters. When you say a patient will need antibiotics, those orders that you're putting in for the dose of the antibiotic, or if you're putting in fluids, you are very, very aware of that responsibility and how impactful like minor things may be. For instance, I remember there was one time on internal medicine where I was giving, or like we had to decide whether we were going to give somebody fluids. And it sounds like such a common thing. Like we give people fluids all the time through their IV. But this gentleman was somebody we were actually waiting for a workup for to come back for heart failure. And for context, if somebody has heart failure, you're very, very careful about how you give them fluids. And this would have been a new diagnosis of heart failure for him. So we actually didn't know if he had it. His workup came back positive. Like he did, in fact, have heart failure. And I was so glad that I had waited and I had taken the time to say, okay, let's not give him any fluids yet. Let's wait and then give him fluids, because I was so aware that any decision, like me just putting in, you know, 100 cc's per hour of fluids could mean the world for this patient. You know, it is the difference between well and unwell. And I think that sense of responsibility comes at you hard and fast. And it's probably the biggest difference between residency and medical school. As a medical student, I can say, maybe fluids are a good idea. But then you tell your resident, the resident thinks about it, and then the resident will also bounce it off the attending. There's people who are going to double check. As a resident, you have your staff, but there are certain, like when you're putting in an order, a staff is not over your shoulder. You need to know what you're putting in as far as an order is concerned, and you need to be aware that everything you say really, really does matter.
Okay.
During her, like, sorry for interrupting you. During her first, like, I want to say few weeks of residency, so I guess there's a system when, like, nurses update the chart or, like, anybody else on the team, they'll, like, write at the bottom, MD aware. And so she'd come home, and so it means, like, the
information has been passed on.
Yeah, the supervising doctor is aware. So she's like, bro, like, I keep seeing MD aware, and I guess, like, that's me. Like, I guess I am aware. Like, I have to be aware. Like, I guess I have to go be, like, I have to know. And she's like, yeah, like, like
they'll ask for my name on the phone, and like as a medical student, no one ever asked me for my name. They're like, okay, we told somebody, but they know that they still need to tell the MD. But if you're the only resident on the floor, or if your staff is elsewhere and they need to tell somebody about something that's happened on the floor, they'll be like, they'll tell me something, and then I'm like, okay, yes, let's do this and this. And then they're like, so what's your name? Just so I can put it in.
Legally,
you are the person who is aware of this. And you're every single time that happens, I'm like, am I really, like, did I say everything I needed to say? Yeah.
Oh my gosh, that's so much. Do you feel the pressure? Or
I think I feel, like you feel it the first few times for sure. And I think every single time it happens, you're aware that it's happening.
But it's important.
But agreed. Like, and I completely understand why it needs to happen. I think you get used to it in the sense that you know it's going to come. Every single time you get a phone call and that information is passed along, you're aware that somebody's going to ask you for your name by the end of it. But I think what I never lose sight of is, like, at least in the beginning of my training as a first-year resident, I am always aware that every time I attend to a phone call, I'm always going to be like, okay, did I say everything I needed to say? Did I ask all the questions I needed to ask to have my name on that piece of paper and be okay with the outcomes that will come from that decision?
Like, mind you, this could be on call at 3 a.m.
Yeah, like, you'll be getting phone calls at, like, 4 a.m. Like, can we give this patient a medication because their blood pressure is elevated? And, you know, it sounds like such a benign question. Obviously, you want to bring people's blood pressure down. But if this is somebody whose blood pressure needs to be kept within a strict range, you need to be very careful of the dose that you're giving this person or which medication you're giving them. For example, if somebody has some, like, if they're at a specific stage of chronic kidney disease, there are certain medications that they can't have. And you can't just give it to them because it's 4 a.m. and you're tired. You need to know, okay, is this something that this patient can have? Mind you, there are like 30 patients that you're taking care of. So you need to be aware, okay, what was the patient that I need to be aware of? What is it that I need to know? Like, so yeah, that can definitely be heightened responsibility.
So do you not struggle with anxiety? Do you not have any of that?
Good question.
I don't understand how you... I'm overwhelmed.
I think hearing it. Yeah, no, I think I can completely understand where that comes from. I think medical school itself actually does a really good job of graded responsibility. Like, as you go through the stages of medical training, the amount of responsibility you're giving, again, with the caveat that medical student to resident is a huge jump, but through medical school, you're given a level of responsibility as a clerk, for example, in 3rd or 4th year, where you're going to get calls in the middle of the night. So you could start getting used to the idea of being given those calls.
Oh my God.
I'm looking forward to
if
it.
I had to be woken up, dude,
Girl.
okay, the fire alarm went off in my building the other night. It's a couple weeks ago. I had been asleep for a while, and the fire alarm went off, and I literally was like,
hello.
I don't care.
It's fine. I'm going back to
If there's
sleep.
really a fire, I'm sure someone will come and get me. I'm going back to sleep. I can't be bothered.
Exactly, which is like exactly
the
how most
normal
people-
human reaction.
Yeah.
Exactly. And when you come into medical school, you're not somebody who, unless you come from a different background, like a lot of people who just came straight from undergrad or non-healthcare careers, they're not used to being awoken in the middle of the night for health-related questions. So as a medical student, they give you that responsibility in 3rd and 4th year where you're going to get those calls. You have to be prepared with a plan when you call your resident because you say, oh, I got a call from the nurse and this has happened. This is my plan. You need to at least have some semblance of like, I'm thinking about what needs to be done next. But again, that final responsibility is not all on you yet. So you're not necessarily quite as anxious because you know there's somebody else to work with and somebody who ideally knows more than you.
Okay.
And then obviously as a resident, you definitely get a little bit more anxious. Like I will say during the beginning of residency, I was very anxious even with like minor orders, like giving somebody, like I said, fluids. Like it was something that I thought about a million times. And part of me is glad that I had that level of like anxiety around whether to give someone fluids because ultimately I had to be, sure, you know what I mean? But I think like as time progresses and as you start to see that the consequences of your decisions aren't actually always bad. Like you're actually doing good for your patient. You build confidence in your skills. You're like, okay, I actually know when to give someone fluids. I know which fluids to choose. I know what medication to give someone. I recognize the difference between a sick and non-sick patient. So the anxiety is actually beneficial in some sense, but also it helps build confidence along the way because you're like, well, I've thought this through a million times before. And now I'm starting to be able to think through it a lot faster and a lot more confidently.
Okay, that makes sense. Okay, so like this kind of is what I'm about to ask you, but like is there something that like first year resident you wish she knew before starting residency? And I want to know if there's something second year medical student you wish she knew before starting
can
it.
start since you were
Okay. Yeah, I think it kind of ties that kind of ties into what I was saying earlier is like trust yourself.
Okay.
You know, I think as a medical student or generally in medical training, you're actually humbled very, very fast. And I feel like you've probably felt this at this point too. You're humbled very fast by how much there is to know and how little you may know in comparison to the sea of knowledge that is available for you to know. And so I think when you have that like mentality, sometimes it can be really hard to trust your gut and know that you've put in the reps and that you have worked hard and you do have the knowledge to at least make a preliminary informed decision. And I think when I began residency, a part of me was still in the, okay, like, is there someone going to constantly double check my work? And there isn't necessarily always someone there to double check your work, especially when it comes to like putting in orders and things like that. So trusting myself was something that I had to learn along the way. And I wish I could go back and tell myself that you did put in the work, you did study, you did do the reps, and knowing that at the very least I have the knowledge to make some general sense of what I'm seeing when a patient presents for the first time is something that I had to give myself grace for. Is like, okay, well, you know, I did go through medical school. I know something. I may not know it all and I may not have all the answers, but that's what residency is for, is to take you to that next level of confidence. But trusting yourself and knowing that you know enough to make at least a well-informed decision to know what to tell your attending when you're trying to propose a treatment plan is something that I would go back and tell myself that, like, it's okay. You don't need to know all the answers, but you do know something.
There you go.
Yeah.
That's great advice. For anyone who needs to hear it. What about you?
Mine sounds so unserious relative to hers. I think what I wish I had known before going into second year is how, like, chill I should have been first year summer. I think in your head you think, like, okay, first and second year, it's called pre-clerkship, basically, where we're not actually on the wards all the time. We're, like, studying in the classroom, whatever, like, more traditionally. And I think first year summer, everybody's like, oh, my God, like, you know, first year summer, everyone's...
I'm sorry. That's not going to be fun for him to edit.
It's okay. I'll just restart that sentence. first year summer, I think everybody's like, oh, we need research, we need this, like start prepping for residency and applications. And it's like, you know, everybody's very go, go, go. It's serious, it's serious. And you think, okay, second year is also just like studying and chill. But like there is like a transition that you will notice. I've already noticed it. We've had our sessions about like clerkship and ranking things. And it's like, okay, it's serious now. Like, do you want surgery first? Do you want this first? Like start figuring out what career you want to go into because you need to start ranking now. Yeah, I know. Stressful. It's very, honestly, like quite stressful. I can't lie.
Of course. Oh my gosh.
So, and then everybody that we talk to that's an upper year is like, oh, you know, like the summer between second and third year is basically the last summer of your life. Like, we're not trying to scare you, but everything after that is just like, I'm taking time off of school, off of my job, but it's like, it's not a vacation that's like a summer vacation.
Yeah.
So now I'm just like, you know, I wish I had also known that earlier so that first year summer, while I did, you know, I will say I did, I think, take a good balance of like traveling and relaxing and working and stuff. I wish I was like also mentally more like, okay, it's fine, relax, like it's good. Yeah. Because now second year summer, while I will try my best to be like relaxed and chill, I feel like it'll constantly play in my head that it's like, this is the last summer, girl. Like, this is it. So I wish I had known that, which is so like unserious relative to her medical.
But I feel like it's fair for where you are in your
I know.
Because that's the point. That is the difference between where you are and where I am.
Yeah.
Is that it does eventually get more serious.
I know. Wow. And I feel like it's getting too serious too quickly.
Yeah.
Like it's important, obviously, and it's really exciting to start thinking about like, oh, we're gonna be on the wards, like I'm gonna get to see patients every day, and like it's exciting, but like it's also scary. So.
Do you like, not to stress you out, but do you know like, what specialty you're like thinking or what area? Yeah. You can just say no if you don't.
I can't say that I know exactly what, and I think third year, unless you like have known for years based on like you know, family and medicine or like your other experiences. Yeah. I think third year is what really illuminates it for people because you're on the wards and you're like, okay,
that makes sense.
I like the idea of a heart, but do I like the idea of like surgery in a heart all the time, the lifestyle that comes with it, you know what I mean?
I do know what you mean.
No, but just like being in that life is very different than thinking about the life. Like it is not Grey's Anatomy. It's like, you know, no. So I think I don't know exactly what I want to go into. I'm hoping third year will tell me, but I do know I'm like more interested in generalist specialties because I like learning a little bit about everything.
Sure. Yeah.
When I've shadowed and like we do clinical skills in every like basically bodily system. I really enjoyed learning about all of it. So I think generalist, but I'm hoping like third year will give me more insight on that. But that's also why ranking is scary because I'm like, basically you think about it like, oh, if you want this specialty, you want to rank it a little bit earlier, kind of where you want it to come earlier, or you maybe want it to come later, so you're the most impressive and you get a letter. And it's like, you know, there are things to consider, obviously, but it's like, well, if you have multiple things, you just kind of have to find what works best. And that's honestly what like 80% of people are like thinking about too. Nobody knows exactly what they want to go into, but I still think it's like kind of stressful.
Oh my gosh, that's an understatement.
To answer your question though, like generalist specialty, I will say.
Okay, nice.
Maybe if we do this podcast again in a year, I'll give you a little bit more information.
Yeah, saying in a year you'll probably
know what I want to go into.
That's exciting.
Yeah. Scary, but
Is like, has watching your sister go through it made it any less scary or daunting, or has it just like it's the same?
I think we've talked about this briefly.
We have a little bit. I think the benefit, and I will preface by saying it is only beneficial to have someone that has gone through the system, okay? Or like primarily beneficial. Yeah. Of course, it's nice to have someone that knows like these are the steps that you take, albeit they're a little bit different from because we went to different medical schools, but like, you know, essentially you have to do this and like this is how third year will look and this is how fourth year will look. So it's nice to have all of the information for sure. But sometimes like ignorance is bliss. Not knowing is nice. Fair and it's enough. Fine. Yeah. But it's like I have seen her like call shifts or like, not to be mean, but like how she looks after a 26-hour call shift, and I'm like,
can you blame me though? Like I've literally been at work for 26 hours.
I could never blame you for that. Oh my god.
So it's like
I get tired after my
me too. I'll do like clin skills, and I'll like if I'm shadowing afterwards, it's like an 8-9 hour day, and I'm like, oh my god, so much time in the hospital, and I'm on the phone complaining to her, and she's on like hour 18. Oh god, and I'm like, I know, and like you know she'll never say it, but it's like seeing her go through it, I'm like I know more than maybe people that are my friends would know.
That makes sense.
And I think that definitely is like a little bit scarier because I know the details of like, you know, it is this serious and you do have to do all of this. Yeah. So I think there are pitfalls that people don't necessarily like realize, but I will say overall it is very, very helpful to have someone.
Okay, hasn't scared you away. Yet.
No, hasn't scared me away for sure, but it has scared me a little bit, especially for third year because I feel like that's like the roughest transition year because it's like you're going through everything, surgery, like internal medicine, family medicine, ER, OB, and it's like when you know someone that's gone through it, you know which specialties are like, okay, like, you know, this is generally like a heavy call version. Like, you have to be on call a lot, or you have to stay in late a lot, or it's like, you know, there's a lot of running around. And so just like knowing that is like, you go in a little bit, you know, mentally. Like, it's not,
and I agree with that, because I think third year is also very unique. It is probably one of the most unique educational experiences like out there, because not only are you part of a care team in a medical setting, like a real medical setting, the things you do are actually for real patients. You actually also come home. You come home and then you study. Like, you're still a student. Yeah, so you have to study through your exams.
I know. She would come home like post shift. Sorry, I just interrupted you completely.
No, that's okay.
She'll come home post like 26-hour shift, and obviously like she'll go to sleep for a bit, and then so she'll go to bed, like shower, whatever, go to bed at like 10, 11 a.m. And then she'll set an alarm. She's like, call me at 4:30, and I'm like, why? She's like, I have to wake up and study. I'm like, what? And I'm like, you have work tomorrow too? She's like, yes, but I also have an exam at the end of the week.
Yeah.
Hello?
Yeah. So I think that's why third year can definitely be like, going into third year itself can be a little bit of a daunting experience, because you know what you're going into, but you also don't even recognize what you're really heading into. Like, you are working a lot of hours to, like, you know, put it, like, to understate it. And then you come home, and then you're also studying, and you're also doing research, and you're doing extracurriculars, because you still have the match looming over your head.
Yeah, it's not
you
over.
You are not, like, you're not at the end of your medical training. You still have the final, I would say, like, the pinnacle of medical school is like where you are finally applying to the specialty of your choice, deciding what part of the country you will be sent to complete the next phase of your training. And all of that is contingent upon how you perform usually in third and fourth year.
How, I mean, like, genuinely, your mental state must be like it's very impressive to me, because I don't know how I get overwhelmed thinking about if I just have too many things to do in like the week. Like, I don't know, like truly, how are you okay with like, okay, I know I'm just like, this is my life for the next
whatever
like
amount of time.
very, very long time, being okay with like, I'm not gonna really get to have much of a social life. I'm assuming that's how it is, or maybe it's not.
Yeah, I think it varies rotation to rotation, but yes.
But you have to be comfortable knowing that.
It's
exactly. Not always,
and that's true.
50-50.
Like, it is actually true that you won't always have that balance, for sure.
And what keeps you like still going? Like, what makes you be like, this is really hard, but I'm still doing it? Like, how do you, like, not to say that I would give up.
No, of course. It's a valid, like, the questions that you are asking are so valid.
Yeah. I think the first, like, really important piece is, don't go into medicine unless you are genuinely passionate and interested and you want to do this. I think if you go in for any other reason, and there's many reasons people go, like, you know, whatever it may be, financial reasons, familial pressure, whatever it is, I think those are not the right reasons, because you will get burnt out. It's like you're saying, there is no, you know, escape from it unless you love what you do.
Okay.
So it's like, if the 8 hours or 26 hours or 16 hours at work is not even slightly fun for you, you're not going to have a good time, you know? So I think the biggest piece is, go in if you are passionate, truly passionate. In terms of being overwhelmed, maybe like you can answer a little bit, but what I'm like hoping will keep me not so overwhelmed, I think it's like a two or like multi-parted. One is just like the system, it genuinely, they want you to succeed, you know? There will be pressure from your residents, from like fourth year medical students to third years, or like the staff as well. But like, pressure makes diamonds. Like, you know, ultimately they want you to do well. These are the quotes that keep us going. No.
Yeah, you said that and I was like, so true. You know what? That's so true.
But yeah, like, but you know, everybody truly does want you to succeed. Like, they will check in on you. She's told me multiple times when she's like on a busy shift, like the doctor that's supervising her essentially will text her and be like, you know, like, are you okay? Have you eaten? Have you had water? And it's like, to know that someone cares is really nice. And I think that helps you a little bit. And then also just knowing that your cohort is also going through the same thing. You know, like, you're not at the hospital alone. Like, the people that have the same rotations as you are probably struggling the same way as you. I think in third and fourth year, like, maybe trauma bond is not the right word, but it's like, you know, you bond.
I was just saying misery loves company.
Yeah, exactly. But it's like, you'll complain together, you'll rant together. People are way more upfront about like, I'm so tired, I can't do this, I can't do that. And then so you study together, you know. You go through it with someone or a group of people, so you know that there are people supporting you. And I think that helps you a little bit. But inevitably, you will get overwhelmed. Like, if anybody tells you it's like, oh, it's easy, you're like, flying through it. I don't think that's true, and I don't think that's a fair picture to paint. It is hard, but you do have to know that, like, there's a reason there's so much pressure put on you. Ultimately, like she said, like, when someone asks you a question as a doctor, and I've experienced this as a medical student, because sometimes people are like, okay, well, she still knows more than, you know, the average person. So it's like, what you say really matters. And when you realize that patients truly put so much faith in you, you're like, you know, this is important. Like, I should know this. I do want to learn this so that I can, like, be the best doctor that I can be.
You guys are just both so into it and passionate, and you care so much, like, you work so hard. Like, I really mean that, though.
Oh,
like,
that's really sweet.
Your attitude is so good about it.
That's really sweet. I think when you talk about, like, stuff that keeps you going, though, like, it's
that.
It's that. When you're, like, literally the other day, I was in the clinic, and I had a patient who, because you're a resident, you work around the hospital. And so I will have seen a patient in Emerge, and then I'll see them when they're admitted upstairs, because I'll be in Emerge when I'm on call. And then I'll be upstairs when I'm not on call on the wards. So I'll take care of them when they're on the wards. And if they don't have a family doctor, I'll say, oh, we're actually accepting patients in the clinic downstairs. And sometimes I will see them in the clinic downstairs. So I have seen them through their entire journey through the hospital. And it happens more often than I actually thought it would. And when a patient comes to you with a very, very complicated medical situation, and then you've helped them work through all of that, and then now you're seeing them kind of at the tail end of that whole situation. And then when they say, like, I'm so glad you were there, or thank you so much for being involved, or thank you so much for...
So many people have said this, like, you've made this experience so much more smooth and calm for me. It's like,
and for a resident, that actually means so much, because you genuinely feel like you're making an impact. Like, when you're lost in those 26-hour call shifts, or when you're constantly at work, you lose sight of the fact that you are doing good, you know, you are helping people. And when someone actually reminds you of that and puts a mirror to your face and say, like, you actually did help me here, like, thank you, you're like, oh, like, thanks.
You're doing something
right. Exactly.
Okay, that makes a lot of sense. That's very... What was your first moment that you can think of where you were like, oh, wow, this is, like, real, like, in training, like, you're like, oh, we're handling people's lives?
I think mine was actually quite recent in second year. So in first year, obviously, we go to the wards as part of clinical skills quite often, but we very much use the, like, your preceptor is with you the whole time, or, like, a buddy system where, like, two medical students will go into a patient room together. I think second year, like she said, they start preparing you for, like, okay, now you're kind of going to do this on your own.
Sorry. Will med students go in and speak to a patient without, like, an actual, like, a...
So now we do second year.
So they let you do that. You don't have to have a
resident.
No. Well, to be fair, like, you will go, and then the fourth year med
student will
you're
go,
not
going to be alone.
Like, and then a staff, like, for on the patient's end, there are tons of people collecting information. But on the medical student end, it's like
you do go in alone.
Yeah, and you like you will present this information to an actual supervisor who has the chart. So it's like you can't.
So they trust you to. You have
to. They hope that you have it. And you have
but
to
this
be
is a skill that you work on from day one in medical school.
Like
the act of taking a history. So that's why, like, this is second nature. By the time you're doing this job, you are. This is an expectation.
And you guys, I think you mentioned, like, they bring in, like, actors to, like, be
serious. And they will cry in front of you. They'll scream.
They
will react like a real
You'll
patient.
get some really interesting cases.
And they do it on purpose, obviously, to throw you off. And so you have to, like...
I didn't know that.
Because you will, like, it's acting, but you will see it in real life. It will. When I was a medical student in the first 2 years of my training, I'm like, does this really happen? And then I reached third year, and I was like, oh, they were not lying.
Can be for either of you, but what's been, like, the most humbling moment you've had?
Girl, you know my humbling moment. I fainted.
I thought about that.
That was my most humbling moment.
Do you want to share that story?
Again? Oh my god, as if I haven't embarrassed. No, you're good. I have embarrassed myself so many times at this point.
Only if you want to.
No, I will. Thank you for
the people deserve
Everyone
to know.
knows at this point, So basically, it was my first year of medical school, first time shadowing. I was a keen medical student. I'm like, let me go.
And what clinic was it again?
Guys, stop. It was stroke clinic. Like, it was so... It was so embarrassing. Okay, anyways, it was like a specialty that I was interested in. I'm like, okay, I'm prepared. I'm well, like, studied, ready to go. Anyways, we're in the patient room. The preceptor's, like, checking. Now I know what they were, like, checking for. At the time in first year, I was like, I don't know what you're doing. But they were doing, like, all the nerve tests and whatever. And I'm, like, feeling kind of, like, off, whatever. Next thing I know, my preceptor's face is on top of me. And he's like, are you okay? Are you okay? And it was so... Obviously, he was assessing, like, oh, is she having a seizure? Like, what's going on? Is she okay? And I'm like, what? What's happening? And the patient in the back goes, oh, like, yeah, she looked a little wobbly a couple seconds ago. obviously I fainted, and I was like of the strongest
Not the
belief.
patient saying.
That's what was the stroke patient
the stroke
too.
patient.
No, I know. I was so embarrassed. I literally
Now we
cried
clown
after.
her all the time.
No.
I cried. I was so
That sounds so
embarrassed.
insensitive of me to say at the exact same time as you.
My family makes fun of me all the time about this, like
Oh
to this day.
gosh.
So
I didn't mean to embarrass you. I just mean I think it's a good
No,
story
I
for
think
people
it
to
was a
hear
good
that
story.
you
Yeah.
know, medical professionals also have moments like that.
It's
So
all
it's a
good.
win.
Literally.
Yeah. Oh my
But that was my most
Yeah,
humbling
that's fair.
experience. That you are not above anyone that you think. Like, you
No.
know, it'll happen to you too. Just
Yeah.
wait.
Yeah.
Oh, of course.
So,
Wow.
yeah.
I think my most humbling, but also like this is real moment was probably like in first year I was shadowing cardiac surgery, and it was
Like, why do yours sound so much more
no,
professional
but it was
than mine?
because I thought about it, and I'm like, well, like when do people faint in the OR? And I thought about my first time in the OR.
whatever.
But anyways, I was not doing cardiac surgery. I was shadowing
Watching
cardiac
cardiac
surgery.
Even that.
I was shadowing cardiac surgery, and it was like a cabbage procedure where it's basically open heart surgery. It's,
Okay.
where they reattach different vessels to re-establish flow of blood into the heart.
Sure.
And
With
there's a moment when they open the chest cavity up and you can see the heart beating,
That is something
literally beating.
so few people get to see.
Yeah.
And there was and I will forever be grateful to the surgeon. I don't even know if he's watching this, but Dr. Nagpal, thank you for letting me shadow you that day. He allowed me to scrub in, and there was a moment where he needed me to hold something within the cavity, and the heart was literally like in my hands,
Yeah.
and it was like a beating. Like that moment, I will never forget that moment, because it was like, this is real. This is a real human heart. These are real lives.
You're holding someone's life. in your
Exactly.
hand.
And that piece of life or death, it is so humbling. Like it comes exactly back to what you were talking about on the ward, where when people are asking you questions, that's someone who is awake and asking you questions.
Yeah.
But when people are asleep and they
Trusting
just
you.
blindly have, not even blindly is a loose term, but they truly have such unwavering faith in you.
Yeah.
I think that is a very humbling experience, to
Yeah.
know that you're not here for no reason. You're not here to, have
Yeah.
like just random moments. This is a real job with real people's lives,
Yeah.
real life and death at stake here.
Yeah.
And I think that moment, it comes again and again in every phase of medical training,
But-
in the ORs, on the wards, in the clinics, whenever a patient is with you,
Mm-hmm.
you're constantly reminded that that's your job.
Have you ever? This is sad. Have you ever seen a person die?
I haven't yet.
Okay.
I have.
You have.
Yeah, I have. It comes at some point in everyone's medical training.
Oh my gosh.
And I mean, it never, the feeling that you have when that happens,
Yeah.
I don't think it ever goes away,
Mm-hmm.
because it goes against the very essence of what we're trained to do in medicine. Our job is, to put it very broadly, is to help prolong life,
Sure.
for the most part.
Yeah.
We want to put people in the best health as possible.
Yeah.
And when somebody dies, whether or not it was a consequence of decisions that were made under your care, it always hits every single time,
Yeah.
because it's something that you recognize in that moment as understanding that life is so fragile. You can do
Yeah.
all the things in the world. You can have the best, most world-class healthcare system. You can have state-of-the-art equipment. You can have physicians who have the most knowledge in the world.
Yeah.
And even still, you may fail at the job of prolonging life.
Yeah.
And it's not that you necessarily failed at your job. You may have done everything you possibly can,
Mhm.
but even still, the realization that there is only so much that we can do
Yeah.
is always humbling.
Yeah.
Yeah.
Wow. Does it give you a kind of a different perspective on life? Like when you started actually like seeing that sort of thing, did it make you realize like life is like can be really short?
Yeah.
Like, can be really
I think that
fragile,
was
and-
my perspective, for
Yeah.
sure.
Yeah.
I started clerkship and specifically medical school at a very interesting time in history. I started it during COVID.
Okay.
And we were seeing, the death toll rise by the
yeah.
day. We were seeing people constantly affected, people separated from their loved ones in the ICU, on the wards, admitted with nobody able to visit them. And we were at the front lines. I wasn't even a physician at that point, but I was seeing the people that were teaching me at the front lines with these patients, trying to save their lives, trying to give them as much care as they possibly could. And sometimes it didn't necessarily always work out.
Yeah.
And the recognition that some of these patients were as young as I was, in their 20s, maybe some of them in their 30s, was something that made me realize that we are not immune to health and disease.
Okay.
We are also humans.
Yeah.
Just because we learn about health and disease and how to treat disease doesn't make us immune to developing any sort of illness.
Yeah.
And I think it made me take my health a lot more seriously, but also pushed me to push my family to take their health a lot more seriously, because I recognize that the decisions we make today do impact our tomorrow, and that life is short. You don't know when that tomorrow is going to come.
Yeah.
And so knowing that, I think, gave me a broader perspective and a broader appreciation for sure of how fragile life can be and sometimes how little we can do.
Oh man, what an answer. That was great. That was so inspirational. You just hear this all day?
I do.
You're
But
like,
I love
yeah,
hearing it,
yeah, Okay. I have to imagine some crazy things happen, and I really would like to know some of them.
So you definitely see everything under the sun. I think
Such as?
I've had some patients come in with foreign objects lodged in parts of the body that maybe we wouldn't have expected.
Yeah.
You wouldn't have expected the foreign objects too.
Oh,
Yeah.
the ones that are
Yeah,
objects.
yeah.
Okay, yeah.
But outside of medical things, we see obviously very, very interesting medical cases that come through the Emerge. But I think something that we also don't see is very interesting dynamics between patients and their support system. So literally the other day I was in Emerge and I was assessing a patient and she was non-English speaking. So I had a translator with me and her partner, who had described himself as her boyfriend, was in the room and sitting there while I was assessing her. And I remember asking her kind of questions about why she was in there. And she was like, yeah, I've been really stressed. And I was like, what's been causing your stress? And I will never forget this. She's like, if I'm the patient, she literally looks up, looks over at her man and goes, well, I'm going through a breakup in front of her.
That was how she
That's how she broke it to
He's
him.
like, what?
Oh my gosh, that's crazy.
And her boyfriend looked up and was like, what? And she's like, yeah. And that was the breakup.
You just were there.
I was just there.
Face, like she
And
can't
I was
say
like,
anything.
I was too stunned to speak.
I believe that.
I genuinely, the interpreter was too stunned to speak.
Oh, I forgot that there was an interpreter.
Another person there too.
Oh
The
my
interpreter,
gosh.
because it was they have different interpretation systems, but you can have an audio interpreter and a video interpreter, and the interpreter just went silent for a moment, and I was like, maybe someone should interpret that for the boyfriend.
Oh my god.
Oh my god.
Oh, was he English?
No, he understood it,
Oh.
but then because he went, what? I'm like, did you not understand the full details?
Oh
And
my
she's
God.
like, yeah.
So then, literally, what happened?
He
after
walked
that?
out.
He just left.
He left.
Just because he
That
was
was a
well, I guess
breakup.
that's the,
That was it?
Well, then, so did she keep talking to
She
you?
told me a little bit about the situation, but
And then she was like, was that the reason why she had to go in? She was like, stressed?
it was the reason she came in was a medical thing, but she says the medical reason was actually related to the stress from her
Stress.
life,
Got
which
it.
allegedly came from the breakup that she was going through.
She was like, let me solve all my problems
Wow.
right here, right now.
I was like 4 years of medical school could never have prepared me for this moment right here.
What a
I
crazy way.
genuinely was like, this has to be a simulation. Like
Yeah,
someone's looking
yeah,
at me right now.
someone's testing
Like
how I
someone
handle
is actually
situations.
this is an OSCE right now because why did I just witness a breakup?
That's
so
In
funny.
the and it was totally like the reason. Sometimes we have patients come in for like psychiatric issues, like they're depressed or they're anxious or whatever it may be. So you naturally expect the psychosocial stressors to be a part of the discussion, but this was a medical thing she came in for. She came in for like pain and weakness, and then she was like, well, I'm going through a breakup.
What a way to break it off.
I know.
To be like, by the way, we're going through a breakup.
We're going through
Right
one
now.
right now
Right,
at this
like,
moment.
that's
This is
what's
the
No
stressful.
questions, no discussion. I'm telling
that.
you.
Crazy. of
Yeah,
her to,
he was like, what? And
bring
he
him
was
in.
like, and I could tell he was
She's a brave
embarrassed
girl.
too. And I needed to do a physical
Yeah.
exam, so I was like,
Were they young? Or
Yeah,
like
how old were they?
I want to say like they weren't like super super young, but they were like
30s, like 40s?
maybe like at least within their 40s.
Oh, I was picturing like 20.
Yeah, me
No.
too.
Oh,
No,
wow.
at
okay.
least like yeah,
Oh,
Wow.
yeah.
that is crazy.
so
It was crazy. Like it felt like reality TV. I was like, whoa.
And you just had to be like,
So where's the
anyways.
pain? Like where? Yeah. Like,
That's so funny.
yeah. But that, so you don't expect to see that emerge. Like, you know, you think I'm the emerge, like I'm working in the emerge, I'm gonna go see someone with chest pain.
Yeah.
You don't think that the reason someone's coming in with chest pain is because they're going to a breakup, through a breakup in that moment.
Okay, well, I do need to wrap up. What's something you'd like people to know about medical school, medical training, being in residency, things like that?
I can start. I think something that people don't actually know, or at least I feel like they don't know, is people have this very like fixed perception of what medical students and doctors are like. Very like studious, like nerdy, educated. You know what I mean? Like working very hard studying, which is all very, very true. Yeah. This is a huge part of like who we are. But I think people forget that we're also people with interests and passions and like talent. Just yesterday, I went to the opening show of this like theater production put on by medical students, and it's like a charitable thing. It's called Daffy at U of T, and it's like to collect, or like, you know, it's for charity for the Canadian Cancer Society, so they were fundraising for it, and it was incredible. Like medical students acting, like script writing, producing, lighting, music, dancers, and I had a lot of friends in it, a lot of friends like that were producing and directing and all of that, and it was so, if you saw these people, you would think this was their full-time job. And so to think that they are full-time like medical students working to be physicians, but also have so many interests and passions, I was like, you know, like people don't know this about us, that like there's so much more to a medical student or even a doctor than one would imagine. So I think it would surprise people to learn that like these were competitive dancers at one point, like they have been actors, they have been like they've won awards, like it's insane. That's really cool. And so it's just like there's more to us than medicine. That's a great point. A lot of us, but like there is way more. So.
Wow, that's awesome.
Yeah. I think along the same lines is like, at the end of the day, we're all just humans. Like we are genuinely just people who love what we do, and we love engaging in patient care. But ultimately, we are people who have lives outside of medicine. We have families that we love, that love us. We have interests outside of medicine. I was talking about this like literally this morning. I was at an emerge shift, and this was like before our shift had started. We were just putting our stuff into our lockers, and the preceptor I was working with was talking with me, and we were talking about Love is Blind.
Oh my gosh, I just started watching it last night.
Yeah, okay, and it's like, you know, you're at work, but if you find joy in the things you do, you see humanity in the people that you work with.
And it was so like girly pop connection.
It was, it was such a like, and you don't, there's always like a hierarchy in medicine, but this is my attending, you know, my staff. And we're just talking about reality TV right before our shift starts. It was a great, like, it was such a moment to remind me that, like, we're really just here to do what we love, you know? Every moment doesn't have to be this, like, super grave, heavy situation. We are here to do our job, but we also have fun doing our job. And I think that is ultimately what makes medicine such an enjoyable place, because you're surrounded by people who actually find so much joy in what they do, and they show up every single day to make everybody else's lives better. You know, whether that's a storm, like a winter storm, you're showing up in terrible weather conditions, you're showing up despite what may be happening in your own personal life, you're showing up through a global pandemic, you are showing up to make a difference in a meaningful way. And behind all of that, you are really just normal people. And I think remembering that can actually just bring a lot of lightheartedness into the situation. Because you see your doctor as somebody that is also human, you know? And I think that that can really help a patient feel safe and connected to somebody that can otherwise be very intimidating.
Thank you guys so much for sharing and for coming
Thanks
on
for having
today.
us.
Thank you so much for having us.
The Brahmbhatts, they're awesome. Where can people find you if they want to follow you on social media?
Instagram at the Brahmbhatts, or
TikTok at the Brahmbhatts _.
You guys, this is so cool. Thank you so much for coming on.
Thank you for having us.
Thank you for having us. This was so fun.
I know. We love talking to you.
We love talking to you.
Oh, same. Okay.
We've been looking forward to this day for so long.
I know.
Oh, yeah. Thanks for watching, everyone.
Thanks for watching.
Bye.